What if I told you that the position you sleep in tonight could either protect your heart or quietly damage it? What if something you do every single night for 7 or 8 hours, completely unconsciously, is either helping your cardiovascular system heal and recover, or putting it under a kind of stress that builds up over years and eventually contributes to a stroke, a blood clot, or a heart attack? You are about to find out something that most people will never hear from their doctor. Something so simple it sounds almost too good to be true. And yet the science behind it is real, the research is published, and the results for people who make this one small change are genuinely remarkable. My name is Dr. Kami William. I have spent years studying cardiovascular health, sleep medicine, and the relationship between the two, and in all that time, one of the most consistent and surprising things I have encountered is how profoundly the position of your body during sleep affects the health of your heart, your brain, your blood vessels, and your overall risk of cardiovascular disease. Tonight, after you finish watching this, you may never sleep the same way again. And that is a very good thing. Let me start with a question. How do you sleep? Think about it right now. Do you sleep on your back, staring at the ceiling? Do you sleep on your stomach, face pressed into the pillow? Or do you sleep on your side? And if so, which side? Left or right? Most people have never given this a single moment of serious thought. Sleep is sleep. You close your eyes, you lose consciousness, and hours later you wake up. What could possibly matter about the position of your body during that time? As it turns out, everything. Because while you are asleep and completely unaware, your heart is still working. Your blood is still circulating. Your lymphatic system is still clearing waste from your brain. Your arteries are either resting and recovering, or they are under unnecessary pressure, and the position of your body determines which of these is happening. Let me tell you about a woman named Margaret. She was 67 years old, a retired school teacher, grandmother of 4. She had mild hypertension, slightly elevated blood pressure that her doctor monitored regularly. She slept on her back every night, had done so her entire life, and considered herself a good sleeper. She never snored loudly, never felt particularly unwell. But over the course of 3 years she began waking up with headaches. Her blood pressure readings at morning checkups were consistently higher than her evening readings. She felt mentally foggy in the mornings, and one morning she woke up with a strange numbness in her left hand that lasted for almost 20 minutes before fading. Her doctor recognized it immediately as a TIA, a transient ischemic attack, a mini-stroke, a warning. When I sat with Margaret and her family and we went through every aspect of her daily life and routine, we came to her sleep. And when I asked her about her sleeping position and explained what I am about to explain to you, she looked at me and said, "Nobody has ever asked me that before in my entire life." So let me ask you what nobody has ever asked you. Are you sleeping in the position that your heart needs you to sleep in? Because if you are not, and the majority of people are not, then every single night, for 7 or 8 hours, your body is missing an opportunity to heal, to protect, and to strengthen the most important system keeping you alive. Here is what the research tells us. And I want to be very clear. This is not folklore. This is not internet speculation. This is published cardiovascular and sleep medicine research from institutions around the world. Sleeping on the left side of your body is consistently associated with significant cardiovascular benefits. Let me say that again clearly. Sleeping on your left side, with your left arm slightly extended, your right side of the body above, your heart positioned freely in the chest cavity, is the sleeping position most strongly linked to improved heart function, reduced stroke risk, better lymphatic drainage, lower blood pressure during sleep, and significantly reduced risk of thrombosis, that is, blood clot formation in the veins. and the mechanisms behind these benefits are not mysterious. They are straightforward, biological, and completely logical once you understand the anatomy involved. Your heart sits slightly to the left side of your chest. It is not perfectly centered. The left ventricle, the most powerful pumping chamber of your heart, the one responsible for pushing oxygenated blood out into your entire body, is positioned on the left. When you sleep on your left side, gravity works with your heart rather than against it. The aorta, the largest artery in your body, the main highway through which blood leaves your heart, curves to the left as it exits the heart. When you sleep on the left side, blood flows downward and forward through the aorta in the direction it naturally wants to travel. Your heart does not have to work as hard. The effort required to maintain circulation during sleep is measurably reduced. And when your heart works less hard during sleep, it recovers more fully. It rests more deeply. It wakes up in better condition than it went to sleep. Now compare this to sleeping on your right side or on your back. When you sleep on your right side, your heart shifts slightly within the chest cavity. The aorta curves away from the direction of gravity rather than with it. Your heart has to work against a subtle but consistent gravitational disadvantage to maintain the same circulation. Night after night, year after year, this creates a cumulative additional workload on the heart muscle. And for people who already have any degree of cardiovascular compromise, elevated blood pressure, arterial stiffness, valve issues, this additional nightly workload matters. It is not catastrophic in a single night, but over months and years it is measurably significant. Sleeping on your back presents a different set of cardiovascular challenges. When you lie flat on your back, the weight of your abdominal organs presses upward against your diaphragm. This restricts the full expansion of your lungs during breathing. Reduced lung expansion means less oxygen entering the bloodstream with each breath. Less oxygen in the blood means your heart must pump harder and faster to deliver the same amount of oxygen to your tissues and organs. Your blood pressure rises slightly. Your heart rate increases slightly. And for people prone to sleep apnea, the condition where breathing repeatedly stops and starts during sleep, back sleeping dramatically worsens the frequency and severity of these episodes. Each apnea episode creates a sudden, sharp spike in blood pressure and a surge of stress hormones that directly damages arterial walls over time. Research published in major cardiovascular journals has shown that untreated sleep apnea, worsened by back sleeping, is one of the most significant and under-recognized risk factors for both stroke and heart attack. Now let us talk specifically about stroke prevention, because this is where the left-side sleeping research becomes particularly compelling. A stroke occurs when blood supply to part of the brain is interrupted, either by a clot blocking an artery or by a vessel bursting. The lymphatic system of the brain, called the lymphatic system, a term coined relatively recently by researchers at the University of Rochester, is responsible for clearing metabolic waste products from brain tissue during sleep. This includes amyloid beta proteins, which are associated with Alzheimer's disease, and other inflammatory debris that accumulates during waking hours. The lymphatic system is most active during sleep, and research has shown that it functions most efficiently when you are sleeping on your left side. The clearance of waste from brain tissue is measurably faster and more complete in left-side sleepers compared to back or right-side sleepers. And the implications of this for long-term brain and cardiovascular health are profound. Accumulated inflammatory debris in brain tissue is directly linked to increased stroke risk, cognitive decline, and cerebrovascular disease. Left-side sleeping clears this debris more effectively every single night. Now let us talk about thrombosis. This is a word that many people have heard but few fully understand, and it is critically important in the context of sleep position. Thrombosis is the formation of blood clots inside blood vessels. When clots form in the deep veins of the legs, a condition called deep vein thrombosis or DVT, they can break free and travel through the bloodstream to the lungs, causing a pulmonary embolism, which is a life-threatening emergency. They can also travel to the brain, causing a stroke. Thrombosis is more likely to occur when blood flow is sluggish, when circulation is slow, when blood pools in the veins, when the natural movement that keeps blood flowing is absent. During sleep, circulation naturally slows, and the position of your body during sleep either facilitates or hinders the venous return of blood from the lower body back to the heart. Sleeping on the left side, with the body's natural anatomical alignment supported by gravity, promotes better venous return during sleep. The inferior vena cava, the large vein that carries deoxygenated blood from the lower body back to the heart, runs along the right side of the spine. When you sleep on the left side, this vein is not compressed or restricted. Blood returns to the heart freely and efficiently. When you sleep on the right side or on your back, there is a greater tendency for this vein to experience compression, slowing venous return and increasing the risk of blood pooling and clot formation. There is another remarkable benefit of left-side sleeping that almost nobody talks about, and it involves your digestive system and its relationship to your cardiovascular health. The stomach and the pancreas both sit slightly to the left of center in the body. When you sleep on the left side, gastric emptying, the process by which the stomach moves its contents into the small intestine, is more efficient. Acid reflux, which occurs when stomach acid travels backward up the esophagus, is dramatically reduced in left-side sleepers compared to right-side sleepers and back sleepers. Now you might be wondering, what does acid reflux have to do with heart health? The answer is more significant than most people realize. Chronic acid reflux causes chronic inflammation in the esophagus and the tissues surrounding it. That inflammation, sustained over years, is linked to systemic inflammatory markers that contribute to arterial damage and cardiovascular disease. Additionally, severe acid reflux episodes during sleep can trigger vagal nerve responses that affect heart rhythm, causing arrhythmias, palpitations, and in vulnerable individuals, more serious cardiac events. Reducing acid reflux through left-side sleeping is not merely a digestive benefit, it is a cardiovascular benefit. I want to go back to Margaret for a moment, because after our conversation, after I explained everything I have just explained to you, Margaret made one change, just one. She began sleeping on her left side. She bought a body pillow to help maintain the position through the night. She was consistent. And 3 months later, 3 months, her morning blood pressure readings had dropped by an average of 8 points systolic. Her morning headaches had almost completely resolved. Her mental clarity upon waking had noticeably improved, and in the 2 years since that conversation, she has not had another TIA episode. Now, I am not telling you that changing your sleep position will cure cardiovascular disease or eliminate stroke risk entirely. That would be irresponsible and untrue. But I am telling you that for Margaret, and for the many patients I have worked with over the years, this single, free, completely accessible change in sleep position has made a measurable and meaningful difference to cardiovascular health outcomes. So how do you actually make the change? Because here is the honest truth. If you have been sleeping in a certain position for decades, your body does not simply cooperate when you decide to change. You will roll back. You will wake up on your back or your right side. You will feel uncomfortable and unfamiliar. This is completely normal and expected. And there are specific strategies that make the transition much easier. The most effective method recommended by sleep specialists and backed by research, is the use of a body pillow or a firm pillow placed behind your back. When you lie on your left side, you position the pillow firmly against your back. This creates a physical barrier that prevents you from rolling backward during sleep. Your body, seeking the path of least resistance, stays on the left side because the pillow blocks the natural rolling movement. Most people adapted this method within 2 to 3 weeks. Within a month, the majority of people find that left-side sleeping has become their natural default position. There is also a technique involving a tennis ball or a small firm object sewn into the back of your sleep shirt. This sounds almost comically simple, and it is, but it works extremely effectively. When you roll onto your back during sleep, the discomfort of the object wakes you just enough to roll back to your side without fully disturbing your sleep. Sleep clinics have used variations of this technique for decades to treat positional sleep apnea, and the same principle applies to training any new sleep position. Within 3 to 4 weeks of consistent use, the majority of people no longer need the object at all. The new position has become habitual. I also want to address a concern that some people raise when I discuss left-side sleeping, and that is shoulder and hip discomfort. It is true that sleeping on your side places more pressure on the shoulder and hip of your lower side. For people who already have shoulder pain, rotator cuff issues, or hip problems, this can be uncomfortable. The solution is mattress and pillow adjustment. A mattress that is too firm does not allow the shoulder and hip to sink slightly into the surface, creating pressure points. A medium-firm mattress with appropriate give allows the body to be supported in alignment without creating pressure-related pain. A pillow of the correct height, thick enough to keep your head and neck in neutral alignment with your spine, is also critical. When the pillow is too thin, the neck angles downward. When it is too thick, the neck angles upward. Both create strain that makes side sleeping uncomfortable. A pillow that keeps your ear, shoulder, and hip in a straight, horizontal line is the correct height for comfortable, sustainable left-side sleeping. Now I want to share something that I think is one of the most powerful pieces of evidence for the cardiovascular importance of sleep position, and it comes from an unexpected source. Researchers studying the sleeping habits of large animals, particularly large mammals, with significant cardiovascular systems, have noted that animals with known heart conditions almost universally show a preference for lying on their left side during rest. Veterinary cardiologists have observed this in horses, in large dogs, in cattle. The body, when under cardiovascular stress, instinctively seeks the position that reduces workload on the heart. Your own body may already be trying to tell you something through your natural sleep preferences. If you find yourself instinctively drawn to left-side sleeping, your cardiovascular system may already be seeking the relief that position provides. Let me address one more sleeping position that deserves specific attention. Stomach sleeping. If you are a stomach sleeper, I want you to hear this clearly. Sleeping on your stomach is the most cardiovascularly and musculoskeletally damaging sleeping position of all. When you sleep face down, your neck must rotate to one side for hours at a stretch, creating chronic cervical strain and nerve compression that affects blood flow to the brain. Your lumbar spine is placed in a position of hyperextension, forcing the lower back into an unnatural curve that compresses the intervertebral discs and the nerves exiting the spinal column. Your breathing is restricted by the weight of your body pressing your chest into the mattress, and your heart, positioned at the front of your chest, has the additional weight of your entire body pressing down onto it, creating compression that restricts its natural movement and increases the effort required for each beat, Stomach sleeping is also associated with significantly higher rates of sleep apnea, acid reflux, and facial nerve compression. If you sleep on your stomach, transitioning to left-side sleeping may be one of the most impactful health changes you can make. I want to close with something that I say to every patient I have ever had this conversation with. Your body does its most important healing work while you sleep. This is not a metaphor. This is biology. During sleep, your cells repair themselves. Your immune system consolidates its defenses. Your brain clears its waste. Your heart recovers from the demands of the day. Your arteries rest and regenerate their inner lining. Sleep is not passive. Sleep is the most active period of biological maintenance your body ever undergoes. And the position of your body during those hours either supports that maintenance or it interferes with it. You spend approximately 1/3 of your entire life asleep. 1/3. If you live to 75 years old, you will have spent 25 years sleeping. 25 years in which your body is either healing your heart or quietly stressing it. The choice of which is happening is, remarkably, largely within your control. And it costs nothing. It requires no prescription, no equipment, no gym membership, no dietary change. It requires only knowledge, which you now have, and the willingness to make one small adjustment tonight. Sleep on your left side. Support yourself with a pillow at your back. Give your heart the gravitational advantage it has always deserved. Give your brain the lymphatic clearance it needs to stay healthy and stroke-free. Give your veins the unobstructed return flow that keeps your blood moving and clot-free. And wake up tomorrow morning knowing that while you slept, your body was working for you in the most complete and protected way it possibly could. Share this with someone you love, because they are sleeping tonight too, and they deserve to know what you now know. I'm Dr. Kane William. Take care of your heart. It takes care of everything else.